Okay, in this class we'll discuss about iron preparation. ಎಲ್ಲೆಲ್ಲಿ ನಾವು ಇದನ್ನ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಆಮೇಲೆ ಯಾವ ಪ್ರಿಪರೇಷನ್ಸ್ ಅವೈಲೇಬಲ್ ಇದಾವೆ, ಯಾವ ರೂಟ್ ಒಳಗೆ ಅವೈಲೇಬಲ್ ಇದಾವೆ, ಆಮೇಲೆ each what are the advantages and disadvantages of each route. So before going to that, a brief background about where we are going to use. Of course it is iron deficiency anemia. So iron deficiency anemia the most common cause andre yade anemia agli first we will try to find out the cause. So edak there is iron deficiency, most of whether it may be because of hemorrhage, blood loss agirbodu, rarely there is nutritional deficiency agirbodu. So what is the cause, we will try to find it out. Adan correction madid nanತರ we are going to correct the iron deficiency anemia. So how we will get to know, we will see the hemoglobin level, RBC level ನೋಡ್ತೀವಿ. ಆಮೇಲೆ there are different laboratory investigations based on which we can diagnose iron deficiency anemia. So ಅದಾದ ನಂತರ we try to ಅದನ್ನ classify ಮಾಡ್ತೀವಿ, mild, moderate, severe. So based on the classification we are going to use different preparations. So where again thus itself is not that it will not dictate which preparation to use. So to know that, to have a complete knowledge, so ನಮಗೆ ಏನು ಬೇಕಂದ್ರೆ ಈ ಪ್ರಿಪರೇಷನ್ಸ್ ಬಗ್ಗೆ ನಮಗೆ ಕಂಪ್ಲೀಟ್ ಫಾರ್ಮಕಾಲಜಿಕಲ್ ನಾಲೆಜ್ ಇದ್ದ ನಂತರನೇ we can try out specific indications. So iron formulations na we have mainly divided into two. One is oral iron formulations, next parenteral. Okay, so oral olaga ferrous preparations ನೀವು ನೆನಪಿಟ್ಕೋರಿ, 1 ferrous sulfate gluconate fumarate. Okay, SGF ನೀವೇನು ನ್ಯೂಮೋನಿಕ್ ಮಾಡ್ಕೋತೀರಿ ಮಾಡ್ಕೋಬಹುದು. ferrous common, SGF ಪ್ರಿಪರೇಷನ್ ನೆನಪಿಟ್ಕೋರಿ, sulfate gluconate fumarate. parenteral ಒಳಗ so iron, so DSS ಅಂತ ನೆನಪಿಟ್ಕೋಬಹುದು ನೀವು. so dextran sucrose complex, sodium gluconate complex. so iron dextran, iron sucrose complex, iron sodium gluconate complex. So it requires practice. So one revision ಮಾಡಿದ್ಮೇಲೆ ನೆನಪಿಟ್ಕೋಬಹುದು ಇದನ್ನ. So we have to read it many times to memorize this. So this is broad classification of iron preparations. So first we'll go for oral iron therapy. So treatment with oral iron should be continued for 3 to 4 months. Once ನಾವು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರೆ 3 to 4 months ಸ್ಟಾರ್ಟ್ ಮಾಡಬೇಕು. ಯಾವಾಗ ಅಂದ್ರೆ once we have corrected the cause of anemia, ಏನು ಕಾಸ್ ಮಾಡಕತ್ತೆ iron deficiency anemia, ಕರೆಕ್ಟ್ ಮಾಡಿದ ಜೊತೆಗೆ the treatment should go for 3 to 4 months. So that duration is absolutely necessary. So usually mild to moderate cases ಒಳಗೆ ನಾವು ಹೋಗ್ತೀವಿ. most important factor is the tolerance of the patient. ಹೆಂಗೆ ಟಾಲರೇಟ್ ಮಾಡ್ಕೋತಾರೆ ಅನ್ನೋದು. ಎದಕ್ಕೆ ಟಾಲರೇಟ್ ಮಾಡ್ಕೋತಾರೆ ಅಂದ್ರೆ, ಎದಕ್ಕೆ ಟಾಲರೇಟ್ ಮಾಡ್ಕೊಳ್ಳಲ್ಲ ಅಂದ್ರೆ because of the adverse effects. Common adverse effects of oral iron therapy include, very common, ನೀವು ಯಾವುದೇ ಡ್ರಗ್ಗಳು nausea, vomiting ಅಂತ ಬರೀತೀರಿ, but in iron therapy it's very commonly encountered. nausea, vomiting, epigastric distress, ನಾವೇನು ಲೇಮನ್ ಟರ್ಮ್ ಒಳಗೆ acidity ಅಂತೀವಲ್ಲ ಅದು. so there will be gastritis, so ಅದು very common. abdominal cramps, abdominal pain ಬರ್ಬೋದು, and very important, constipation. Sometimes most common is constipation, in some it can cause diarrhea as well. And one more associated feature about iron therapy is it will cause blackening of stool. Stool na changes the color of stool to black. So you should educate the patient regarding this, because adu nodevaru bhaya, they may be discouraged to continue because of this change. They may not even come and ask you, so you have to educate the patient regarding this one change. So ivella there are methods by which you can avoid this. So dietary changes helbodu ನೀವು to reduce spicy food, ಆಮೇಲೆ ರೆಗ್ಯುಲರ್ ಇಂಟರ್ವಲ್ ಬಿಟ್ವೀನ್ ಫುಡ್, ಹೈ ಫೈಬರ್ ಇಂಟೇಕ್, ಆಮೇಲೆ ಯು ಕ್ಯಾನ್ ಯೂಸ್ ಪ್ರೋಟಾನ್ ಪಂಪ್ ಇನಿಬಿಟರ್ಸ್ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ರೆಡ್ಯೂಸ್ ಮಾಡೋದಕ್ಕೆ. ಸೊ ಕಾನ್ಸ್ಟಿಪೇಷನ್ ಅಗೇನ್ ಯು ಕ್ಯಾನ್ ಇನ್ಕ್ರೀಸ್ ಹೈ ಫೈಬರ್ ಡಯಟ್. ಸೊ ಜೊತೆಗೆ ಐರನ್ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಜೊತೆಗೆ ಯು ಕ್ಯಾನ್ ಆಲ್ಸೋ ಯೂಸ್ ನ್ಯಾಚುರಲ್ ಸೋರ್ಸಸ್ ಆಫ್ ಐರನ್. ಸೊ ದಿಸ್ ಎಜುಕೇಶನ್ ಇಟ್ ಸೆಲ್ಫ್ ವಿಲ್ ಬಿ ಸಫಿಷಿಯಂಟ್ ಇನ್ ಪೇಷಂಟ್, and you should encourage them to try this, give it a chance. So these effects are usually dose related and can often be overcome by lowering the daily dose. So lower ಮಾಡಿ we can optimize. Okay, and taking the tablets immediately after or with meal. So gastritis reduce ಮಾಡೋದಕ್ಕೆ we can usually go with this. So also one more important indication is in pregnancy. Pregnancy ಒಳಗ we now we start with iron. So ಇಲ್ಲೇ this is very important in pregnancy. ಯಾಕಂದ್ರೆ ಅವಾಗಲೇ ಅವರಿಗೆ there will be morning sickness, nausea, vomiting, constipation ಇವೆಲ್ಲ. So this when we add this, which is mandatory, there is absolutely no other way. You have to start with iron and folic acid in pregnancy. So you should educate the patient. You can optimize the dose and give this basic modification. So so ferrous salts. So we talk about elemental iron. So yade preparation tagondre nav ಏನು ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಆ ಪ್ರಿಪರೇಷನ್ ಎಷ್ಟು ಎಲಿಮೆಂಟ್ ಅಯಾನ್ ನ ಬಾಡಿಗೆ ಪ್ರೊವೈಡ್ ಮಾಡುತ್ತೆ ಅನ್ನೋದು ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಬೇಸ್ಡ್ ಆನ್ ದಟ್ ನಾವು ಡೋಸ್ ಜೊತೆಗೇನೆ ವಿ ಸಿ ದ ಎಲಿಮೆಂಟಲ್ ಅಯಾನ್ ವಿಚ್ ಇಸ್ contributed by this preparation. So that plays very important role. So ferrous salts ಏನು ಮಾಡ್ತಾವಲ್ಲ, they will provide 100 mg will provide 20% of elemental iron. Ferrous fumarate will provide 33%, ferrous sulfate 19%, and ferrous succinate 12%. Okay, so in adults the dose is 200 mg of elemental iron. So this is elemental iron. Okay, so administered in 2 to 3 divided doses after meal. So in children again the dose should be very specific. It is 3 to 5 mg per kg. Okay, so this is the very basic concept. Another now dose jotege we will see the amount of elemental iron contributed by the preparation. Okay, so this one side note you baribodu exam olage, try to remember as much as possible. So other preparations are ferrous salts of sulfate, fumarate, gluconate, lactate. So vella idava, but so don't get confused, don't get discouraged by seeing all this preparation. Just remember the 3 or 4 important preparations which I mentioned. If you are remembering all this, very good. But starting 9th ತೋರಿಸಿದೆ, at least ಅಷ್ಟಾದರೂ ನೆನಪಿಟ್ಕೊಳ್ಳಿ. ನಿಮ್ಮ ಎಕ್ಸಾಮ್ ಬರೆಯಕ this slides you may utilize them as notes. So notes ಈಗ ನಿಮಗೆ ಹೆಲ್ಪ್ ಆಗಬಹುದು ಅಂತ we are elaborating the topic. So these are different preparations. Okay, next, so oral iron therapy. Nantra will go for parenteral iron therapy. So two route which are very common use. One is intramuscular, deep intramuscular, amele innondu IV route. Okay. So where we go to parenteral iron therapy andra, we have specific indications for that. So first we cannot start parenteral iron therapy. So you usually go for moderate to severe. That is one. Next, or reserved for patients with documented iron deficiency who are not able, this is important, who are not able to tolerate or absorb oral iron. So absorption ಮಾಡಕ್ಕಾಗಲ್ಲ, ಲೈಕ್ ಯಾವ ಅಂದ್ರೆ ಇಲ್ಲ ನೋಡ್ರಿ, post gastrectomy conditions absorption ಆಗಲ್ಲ, previous small intestine resection ಆದಾಗ, inflammatory bowel disease ಇರಬೇಕಾದ್ರೆ, malabsorption syndrome ಇರಬೇಕಾದ್ರೆ there is no absorption. Whatever iron you are providing, it is not absorbed so from GI tract. So in that cases you have to provide parenteral iron therapy. Or in other indications like patients with extensive chronic blood loss. So alle and oral iron therapy will take time. It will take its own time to reflect the changes in the blood levels. So immediately bekandre, of course, in these conditions like extensive chronic blood loss irbekadre, you are going for parenteral iron therapy. So preparations ille iron dextran. Now route is also important. It can be given IV or IM. Iron sucrose complex, IV or IM. Iron sodium gluconate, iron sorbitol citrate, specifically for only intramuscular. So try to remember these preparations. Yes, one of very commonly used preparation is iron dextran, a stable complex of ಏನಂದ್ರಿದು ferric hydroxide and lower molecular weight dextran. So that's why it is called iron dextran. Can be given by deep intramuscular injection. So ಏನಂದ್ರೆ iron injections are very painful. So ಬಹಳ painful ಇರೋದ್ರಿಂದ it should be given deep intramuscular ಒಳಗೆ deep. ಆಮೇಲೆ there is a technique known as Z-line technique. So ಅದನ್ನ elevate ಮಾಡಿ Z-line technique ಒಳಗೆ we have to give these injections to prevent staining. So staining cause ಮಾಡ್ತಾವೆ ಇವು, ಆಮೇಲೆ they are extremely painful. So that's why it is usually given in the gluteal region, deep intramuscular, by a technique known as Z-line technique. Okay, so ಮೊದಲೇ patient ಗೆ you should tell the patient it is going to be painful ಅಂತ you tell the patient, prepare the patient and start with this. Intravenous administration eliminates the local pain, yes, but there is one important adverse effect, and let me tell you in the beginning itself, that is hypersensitivity reaction. So please be aware about this condition, that is hypersensitivity reaction, when you are giving parenteral iron therapy, whether it is intramuscular or intravenous. Always this fact should be in the corner of mind. Hypersensitivity reaction, very commonly seen. Amele, that's why it's always better to administer the test dose nodi. If there is no allergy, then you can go with injections, or sometimes the reaction may be delayed. So there it's always better to be ready for the treatment of anaphylactic shock, hypersensitive reaction avakadre. So you should always be alert, and if the patient is discharged, educate the patient regarding the allergic reactions. Very important aspect. ನೀವು ಯಾವಾಗಾದರೂ ಇದನ್ನು ಯೂಸ್ ಮಾಡಿದಾಗ when you come across, don't forget this very important fact. Okay, next preparations are iron sucrose complex and iron sodium gluconate compounds are alternative preparations. They can be given by intravenous route. So usually what, to avoid the pain, intravenous route ononsati hogodu, but the adverse effects naವೇನು last slide ನೋಡಿದ್ವಲ್ಲ, they should always be kept in mind. So these preparation, they have the advantage of having less chance of causing hypersensitivity reaction. That is the added advantage of these preparations. So these are parenteral iron preparations. So ಏನು ಯೂಸ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ depending upon the patient's tolerance. So mild to moderate ಇರಬೇಕಾದ್ರೆ we start with oral iron therapy. Try to explain the patient regarding common adverse effects. Dietary modification change ಮಾಡಿ gastritis ನ constipation ನ reduce ಮಾಡಬಹುದು. ಆಮೇಲೆ ಅಷ್ಟಾಗೋ patient ಅದನ್ನ ಟಾಲರೇಟ್ ಮಾಡಲಿಲ್ಲ, ಅಥವಾ there is no marked improvement, ಅಥವಾ there is failure of therapy, ಅಥವಾ there is other indications like GI absorption reduced because of many factors which we saw, ಅಥವಾ chronic condition, emergency condition where we have to immediately correct the HB levels or iron levels, then we go for parenteral route. We saw different preparations there, and two routes, intramuscular deep, amele IV, and test dose should be given before going for parenteral route, and then parenteral route can be given. So these are different iron preparations and their uses.